just going to talk a little bit about just your history here with Dr. Adam, Alignlife Chiropractic, as well as just your health journey. And so we've learned a little bit about you, but just for camera purposes, can you tell us a bit about yourself and your background?
Well, I'm 71 years old. I had a bad experience with the heart patient thing. As I said, I was born in New York, kind of in Catskill Mountains, and the reason I say that is throughout my health, going to doctors, stuff like that, they'd always do this and say, "Were you born in the mountains?" And I'm like, "No." Yes, So apparently that makes you kind of tough. I come from a long line of very healthy people that live a long life. I had an aunt that was 100 and that type of thing. We were always. I don't remember going to doctors I don't remember going to doctors. However, one time my sisters fed me mothballs when I was little, I guess to see what they do. And that supposedly got me into the doctor, but I don't remember that. I was little. But then the next time I remember going to a doctor, I was going, to like a gynecologist because I was going through menopause. And that was in the 50s. And along the way, I might have gotten a cold. I don't remember being sick. Then when I had what we thought was a heart attack, and then my heart surgery from kind of a weird guy that ghosted me, that's when I really started to realize that people that had aches and pains and couldn't walk, I'd think, oh, just get up and walk. I had this attitude like you could do it. And then I realized when you have limitations, when you get up to make your bed and your heart starts beating so fast, you're sweating, and you have to stop in the middle in order to make the bed, that's when I start to give up. I start to really be hit with depression. And then I have this, my lovely husband and my lovely friends all said, stop it, get up, do something. And my next door neighbor told me I was in a lot of pain, tens all over. She told me about Dr. Adam because she comes here. And the first time we came, he does an evaluation, he sits you down, and doesn't cost anything. You sit down, I'm thinking, this is not medical, I'm not paying anything, He showed me my x-rays when I first saw the horrible repair job the heart surgeon did.
I want to go through a few things when we're looking at a case like Ellie's. So Ellie came in with a really long story of some really tough times, and she couldn't walk. She was having a lot of those issues that really are just poor health. If we keep it really simple, because of all those injuries and things like that have accrued over time, she's just getting further and further and further away from health, and it's a really tough place to be as a patient because you gain momentum either way. If you gain momentum negatively, it's very hard to come back. People think that sometimes we're just pushing this boulder forward, trying to push their health forward, but really it's more like trying to push a boulder uphill. It's really hard at the beginning, but as we get more and more momentum, we'll start to get towards the top, and it gets really easy with time. With someone like her, you're going to see that we have a lot of damage right here. So there's a few things that I'm always going to look at when I'm looking at x-ray. I always want to see, do we have a level foundation? Is our spine straight? Is our head, this is the most functional, is it over the tailbone? Which essentially means, do we know where we are in space? It's something called proprioception. It's a form of balance and things like that. So when I see her, we have a lot of issues going on. We have a slightly shorter leg on this right side. You can see us leaning to compensate for that. And as we've done this, what your x-ray really tells you is how long it's been there. So with someone like this, we have degeneration at every level. So she's been having these issues, having these problems for a lot of years. So we have this really strong lean, we have strong compensations back and forth, and we know that our head should be directly over our tailbone, so that should be, it should be 0 here ideally, but we're 23 millimeters off. Part of that could also be due just to the amount of pain she was in. She couldn't stand for very long at the time. But as much as we tend to focus on this picture, especially with patients here, is the one that's more important is always going to be your lateral view, because we have 3 shock absorbers of the spine here. And the thing is that every one of these areas is made very specifically to hold your weight into these curves. When they've been changed, they start to work a lot harder in some areas. And because of that, we create a lot of stress and inflammation. So your body's going to go and try to start to protect it. So inflammation will happen, pain will happen in order to tell you that there's a problem, because pain is not a problem. It's just a sign your body can't figure out what's going on. So with Ellie here, we have a lot of stress at this L5 disc right in here. And most of this is actually happening because this angle right here is so strong. I would ideally like to see it at about a 35 to 45 degree angle. Hers is in the 50s, so what it does is, think of it simply, if this is my L5 here, and this right here is my tailbone, is that if we're here, you're gonna see where the nerve comes out, there's gonna be a lot of pinching. So if we could take this and eventually get it to go here, it's gonna open up these areas and take a lot of pressure off, which is what we've seen with Ellie here immediately. You'll see this happen over time, but more importantly, in the meantime, as we change this here, because it starts to move properly, her head is going to start, her brain is going to tell this area, says, you know what, since we're moving properly, we don't need so much pain and inflammation, and then her symptoms are going to reduce really quickly. Over time, though, we need this to change, because if it doesn't, it's going to happen over and over and over again, which is why we don't also just base our care plans with the patient off of pain, because pain is actually less than 10% of a nerve's job, a spinal nerve's job. So if we're basing everything off of less than 10%, it doesn't make a lot of sense. What I want to do is measure this over time. I want to look at these numbers with her in particular. In several months, we're going to take a second picture, and I want to compare them, because I love that she's feeling better. I love that she's happy and moving and all those things that are so important for her health. But at the end of the day, if these numbers don't change, then I'm not doing anything different than the guy across the street. It's still just another Band-Aid. We want to get a person to the point where their health is actually changing. Because if we can increase that health, again, we increase your health, your body's able to adapt out of problems. We're not meant to just take pills and rely on someone all the time. We just need to get to the point where our body feels safe. And right now, with some of these numbers, we're not anywhere close. So when we take the second x-ray, and I'm really excited to do that with her because we made some really big changes quickly, that our body should start to feel safer and safer. And in my job, I start to back off more and more, but we continue on with the education. We still have to talk about eating right and exercising and reducing stress and making sure we have a sleep schedule. All those things are important, because if we can't respect those rules, they don't respect us.
Bob and I said, yeah, we like this. We like what this guy's saying. So we came back, had our first adjustment. I cannot tell you, I would stand up, and the sciatica, if you've ever had it, that pain down there would blind me. I'd see stars. Wow. And I'd have to take a couple of steps, that I'd have to sit down. He'd have to carry me, and I couldn't, and I was headed for a wheelchair. And I didn't want to do. That's when, you give up. And I came here, he did one adjustment. It hurt, yes, it hurt. Not a 10. About a 5.5. But he popped that thing, and I could feel the relief. And I got up and I walked out of here to my car, and then my husband looked at me, and I'm like, I'm walking. That was the first adjustment.
Okay, Miss. So, how's everybody feeling today?
Oh, I'm feeling good.
Feeling good? We've been walking?
No, Bob put the stationary bike in my room for me, so.
Oh, is that right? So she got you. Yeah, you moving over there.
He does all the exercise by moving the machines around. He's got a treadmill in the back room. And
that's right. And he said it's connected, or it's in front of the
TV.
The TV right there.
Mm-hmm.
Man, this guy's gonna look great by the end of the football season.
Oh yeah.
Even better.
He's got, once we get on camera, he's going to be intimidated into losing weight, aren't you, honey?
Yes, indeed.
Oh,
He's pretty shy. I'm kind of proud of him for doing this. I'll
I
do
need to trim my
anything.
beard. Who knows?
there you go. You don't want to go too
That's
crazy.
above me.
Had this Unabomber look.
It's all right. I was at the banker there, and I had to show my passport because I let my driver's license expire.
Oops.
But you should see that picture. I mean, I don't know if they want to let me in the airports after that one. They're looking good right here. All right. So our swelling is going down.
Yeah, I'm feeling better.
Our swelling is going down. I remember when you first came in here, it was a really interesting feeling because the skin was we were so inflamed that it was tight.
That's right.
How much movement are we getting a day?
Not much.
Not much?
I gotta be out not much. And I even got whining it to myself about it. Most I think I've been a long time just the whining. So I have to start. We're moving stuff around to get the set and done, and he's moving stuff into the room to exercise, so
So,
I'm going to have to get there immediately.
absolutely. So, I mean, I think the easiest thing that I would recommend to the process too is just setting a timer. And make it short. I don't want you to, it shouldn't be a huge obligation.
Get in the habit first.
Yeah, it could be 5 minutes. It could be less than that.
5 minutes, you crazy?
5 minutes, it could be 3.
That's good, that's Oh, that was good.
There we go. Very good movement there. Perfect. I'm gonna bring you up, okay?
Okay.
1, 2, 3. Just to make sure I got everything here. Got a little tightness when I went on the right side. That's what I wanted to see. Good. Easy.
Am I good now?
You're all good.
Has Dr. Adam provided you any specific advice that's been motivating for you to get through your treatment?
I think it's his attitude towards me, and I think probably all the people that come in here, it's that I can come in and, everybody says, well, how you doing? I'm doing fine, whatever. It's his tone of voice, it's the way he looks at you. You are not a paycheck to him.
Yeah.
Now, if you are, he's the greatest actor of the world. You really know that he cares about your development. I tell him about the different things I want to do, and then I said, would you mind partnering with me kind of on this journey? He said, I'd be glad to. It's his faith in me. It's not just him saying, oh, I just, love you and Bob. It's with his, everything about him, he's going to be there for you.
Yeah.
And I haven't known him that. I mean, maybe it's been, 2-3 months? And I feel like right now, if I had something I need to get off my chest, I could go in and say, I need to talk to somebody, and he'd, boom, he'd be there. That's the way doctors used to be. Doctors used to come to your home for dinner. I mean, that's talking way back, whatever. But now doctors are, they're in and out so fast, and their assistants are doing this. And you could be with a doctor for 2 years and never see the doctor. You'd see the nurses and the PAs. And there's even one at my family doctor. There's a young man who's, I'm assuming he's a nurse. I mean, he's either a nurse or a tech or something like that, named Frankie. His voice is so happy. And, they wear those masks, so for the longest time, I didn't know what he looked like. And, I look forward to going in there and seeing him, who may or may not attend the deal.
Right.
But
right.
I look for him like a medicine, like an anchor. And I mean, maybe once or twice I went there and he wasn't there that day, and it really bothered me. I really need to know that somebody in that office cares.
Yeah.
And, I think he'd take a bullet for me. Now, I might be crazy, but that's the way he projects himself, so it makes me want to go. If a doctor did that, such as Dr. Adam, it would encourage me to go.
Yeah.
And
Absolutely. How do you feel now compared to when you first came to Alignlife?
oh my gosh, when I first came here, I was in so much pain I couldn't really think. And somebody had asked me a question, I'd have to say, what? Because all I could think about was the pain. And I just didn't experience pain in my life. I didn't, wasn't used to it. And I wasn't functioning as a person. And Elizabeth kept saying, you got to go see this guy for probably 2 months. And I don't exactly know how, but one day we just decided to come here. And when I left, and I felt so much better so quickly after one adjustment, that I thought, I am going to get better. It doesn't matter that I'm 71. I could be 20. I'm going to come in here with the attitude that if it can be fixed, he can fix it. And if it can't be fixed, I believe that he will tell me, you need to find a good whatever doctor or whatever, or do this or do that, or take an EVA, whatever it is. I eat everything. I'm an Italian kid that eats everything. So I don't really know what's good or bad. I was raised with pasta's good. You eat pasta every day. Yeah. That's not good for you every day. And then Bob is a very, he'll eat seaweed. I mean, stuff like that. But he also has a nutrition thing, a nutritionist that he hooks up with. So it's not just going to be come in here, crack my bones, and I'm leaving, that's it. He's going to be a continuing part, and I realize how important it is, especially for me and people my age, to come in periodically, once every 6 months, just to get checked, to get adjusted, because your bones are moving every day.
Yeah.
So I have a plan, and I have somebody that will help me find the plan, find the people. He even helped me find you.
Wow. Look at that.
I mean, he's a handy man.
Yeah, he is. Let me ask you this. Are there things that you can do now that you weren't able to do before?
Well, I can run around. I can chase the dogs. We had Christmas dogs, 2 little Frenchies that
Let's go.
got here.
What's their name?
Well, it's Winston and Joshua.
Love it.
But first it was Jean-Luc and Jean-Pierre, and then now we call them 1 potato, 2 potato because they look like potatoes. But I can participate. I mean, it sounds funny. I can sit up and I can sit at my computer. I can sit at the dinner table. I don't have to lay down every 5 minutes. I can make my whole bed. Now I can't clean the house, but I probably wouldn't anyway. You know, but I can do a whole lot more physically than I could before. That's the biggest difference. Is I can get up and walk from one end of the house to the other. I can stand and help him cook, and you know, just little things in life that I was in bed all the time.
Yeah.
And God, that's depressing.
Absolutely.
You know, so
What would you say were expectations coming into this process, as opposed to how do they compare to where you are now?
coming in, I will say it was because Elizabeth kept pushing. I came in to keep her quiet. And I think I had been to a chiropractor before, and a very nice man. And I think I really thought, well, after a few months, the pain will go away. And then, like where I am now, I'm stunned. I had no idea I'd ever get to the point I am now. And this is just the middle of my road here. I'm going to be able to do those long walks, take the dogs for a walk around the couple blocks, you know, stuff like that. I want to be able to push that furniture around again if I want to. And I feel like I can now.
Down, what message would you like to share with people suffering from chronic pain and looking for hope?
Definitely the message is do not accept. See, I don't want to say that all doctors are bad, but do not accept one person's opinion. If somebody says, okay, for your back, I'm going to give you ABC, a pill. Ask them what the side effects are, because I've had a lot of doctors say, oh, there are no side effects. To come to find out they didn't know there were, or they lied. Do your research. Do not put something in your mouth because a doctor told you to, because they may be misinformed as well. And, you know, Bob did a funny video about taking some medicine for yellow toenails, and then the side effects are everything up to death. And if you read the side effects for most medicine, it's a chemical base that the idea is to kill whatever it is wrong with you before it kills you.
Right.
And I've known a number of people, and I have a friend right now going through chemotherapy for cancer, and he is miserable every single day. Is it worth it? He's come here. He's tried vibration. He's tried everything. People need to treat themselves better and not just be have doctors intimidate them. Don't be intimidated, you know. Do what's best for you, and if people don't understand it, wait, bye-bye. That's my theory.
I love it. Thank you so much. That's
Well,
all the
thank you.
questions I got for you.
Good, because we'll be seeing you on film.
Yes,
pretty soon.
yes.
Well, thank you. Thank you so much. It was so nice meeting you,
Yes,
too.
you as well.
You too, friend. I'll always call you friend. Chad. It's very good meeting you.